Greetings. Let us talk about chronic pancreatitis. And before we go there, we should review the basic structure of pancreas and how it functions. I would like to thank my mentor, Dr. John Stroline, Mr. Charles Butt, for their philanthropy support, Ms. Angela Deal, my institution, and all my mentors. Please read this notice. So let us go to the pancreas. Here is the pancreas sitting beautifully behind the stomach, nestled nicely in the C loop of the duodenum, into which it will secrete and drain the pancreatic juice. So let us take a microscopy, look at the microscopy of the pancreas, and this is what it shows. This is a beautiful structure, and I want you to keep this image in your mind. And a lot of stuff you learn about pancreas can be built by keeping this image in your mind. And let us go into a little more detail. Here is in the center, you see islets of Langerhans, that is the endocrine compartment of the pancreas. The islets secrete hormones like insulin, glucagon, VIP, and pancreatic polypeptide, etc. And then there is an exocrine compartment in the form of acinar cells that secrete various enzymes. And the enzymes are drained down the ducts, and the duct secretes bicarbonate to keep the enzymes in an inactive form, especially the proteolytic enzymes. So let us dive deep into the exocrine function of the pancreas. So we talked about the acini, and they secrete different types of enzymes, amylase, lipase, which are secreted in the active form, and proteolytic enzymes, trypsin, chymotrypsin, carboxypeptidase, and elastase. The proteolytic enzymes are secreted as inactive enzymes, and they get activated once they go down into the duodenum. And how do we keep these enzymes, the proteolytic enzymes, from getting activated inside the pancreas? How do we safeguard that? And this is done by the ducts, which secrete bicarbonate, and keeping the pH in the neutral form prevents the proteolytic precursors of the enzymes in their inactive state. So it's important to have a gland that is secreting enzymes and a duct that is secreting bicarbonate to keep things going into the duodenum where they get activated. So now let us look at in detail about various enzymes, their functions, and what happens when the secretion of these enzymes is limited, which happens in exocrine pancreatic insufficiency. It could happen in various diseases of the pancreas, either because the acini got destroyed or the ducts got obstructed, etc. So let us start with amylase. It is an enzyme that is secreted in the active form. It doesn't damage the duct or the pancreas, as it acts specifically for digesting carbohydrates. If there is not enough amylase going down into the duodenum, and the carbohydrates don't get digested, and as they go down the stream, the bacteria ferment the carbohydrate, the starches, resulting in gas, bloating, and flatulence. So something to keep in mind. Bloating and flatulence, you should think maybe there is carbohydrate digestion absorption problem. Next enzyme is lipase. Lipase is useful for fat digestion. And if the lipase output is not sufficient and the fat digestion is not happening completely, fat can get lost into the stool, and that results in what we call steatorrhea. Patients typically describe that they've been having stools that are foul smelling and sticky to the toilet, and they need to flush again and again to get rid of the stool that was sticking to the toilet. If the steatorrhea was severe, patient may say, I'm seeing oil lakes in the stool. Because fat is calorie dense compared to carbohydrate and protein. And if you don't digest and absorb fat, you lose weight. And in addition, lipase is important for digestion and absorption of fat-soluble vitamins A, D, E, and K. So one can see fat-soluble vitamin deficiency also in patients with pancreatic insufficiency, exocrine pancreatic insufficiency. So we talked about carbohydrate digestion, fat digestion. Let us look at what happens when it comes to protein. So trypsin, chymotrypsin, carboxypeptidase. These are the enzymes that are important for protein digestion, but they are secreted in an inactive form and they get activated once they go into the duodenum by an enzyme called enterokinase. If there's not enough synthesis and secretion of proteolytic enzymes or protein digesting enzymes, you don't digest protein and you don't absorb it, so patient may develop weight loss, muscle wasting, and edema because of hypoproteinemia. In addition to these proteolytic enzymes, there is another important enzyme called elastase. And if somebody is eating a lot of meat and the connective tissue in that meat needs elastase for digestion, and something to keep in mind. Unlike other enzymes, elastase is very stable enzyme and it can be measured in the stool. Unlike trypsin, chymotrypsin, carboxypeptidase, which can get destroyed as they go down the stream in the small intestine and colon, elastase is stable and can be measured. And this is used, measurement of elastase in the stool, otherwise known as fecal elastase level, is used for diagnosing exocrine pancreatic insufficiency. So we talked about different things. So let me summarize. We've understood that the structure of SNS, duct, enzymes, and when there is insufficiency of the exocrine function of the pancreas, you diagnose by assessing the amount of elastase in the stool. That's the first thing. The second one is you want to assess whether they are absorbing enough fat from the meal that they eat. Normally, one should be able to absorb 93% of the fat in the meal. Less than 7% is actually lost in the stool. If there is exocrine pancreatic insufficiency with low amounts of lipase getting into the duodenum with fat maldigestion, one may see a lot more fat in the stool, between more than 7% for sure you can make a diagnosis if it is above 15% of fat loss in the stool. We also learned that lipase is important not only for fat digestion, but also for digestion and absorption of fat-soluble vitamins. So in exocrine pancreatic insufficiency, at the extreme end, you may also notice deficiency of fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K. I hope this is helpful. Next, we will talk a little more about how do you diagnose exocrine pancreatic insufficiency, some of the details that are much more important for residents and trainees, especially fellows. Thank you.